Welcome to Simply RN. Today we will talk about tips and tricks for nasogastric tube insertion. NG tube insertion involves passing the tube through one nostril, along the nasal floor, down the pharynx or the throat, and then the esophagus until the tip of the tube reaches the stomach. The most difficult part of NG tube insertion is when you reach the soft palate. You have to pass this turn at nasopharynx and continue down the distal pharynx, which we will discuss more later in the video. Let's first talk about some tips before insertion. First, you want to measure how long of the tube you would need to insert. Grab the tip of the tube and measure from the tip of the nose to the earlobe, and then against the throat down to the xiphoid process, which is the bottom of the sternum. You can locate it by feeling for the sternum, which is the long, flat bone running down the center of the chest, and then finding the pointed end at the bottom. That is the xiphoid process. Expect the length of the tube averages between 55 to 65 centimeters. The next tip you may want to consider is using a 2% lidocaine gel to numb the nasopharyngeal space before insertion. It is not a requirement nor standard practice in some facilities, but it may be helpful for those with traumatic NG tube insertion from prior experience or those who are very anxious. When administering the 2% lidocaine gel, which comes in syringes, have the patient sit upright and squirt 3 milliliters into the nostril and have the patient snort the gel like a nasal spray. Allow 15 to 20 minutes for maximum anesthetic effect before inserting. Be mindful that the maximum safe dose for lidocaine is 4.5 milligrams per kilogram for adults. The next few tips involve changing the elasticity of the tube. What does that mean? Remember that in order to advance the tube, you need to pass the nasopharynx, which is an angled turn. So just right before you insert the NG tube, coil and curve the tip of the tube about 4 to 6 inches around your index finger for a few seconds. By doing so, you have created a slightly curved tube that mimics the anatomy of the nasopharynx and makes the insertion smoother. If the type of NG tube you are using is too flaccid or soft, it is hard to maintain the curve and it can also coil up in the pharynx. In order to prevent that, you can stiffen the tube by freezing it. You can do so by putting it in ice water or filling the tube with water and then freezing it. Cooled tubes are less flexible and can better retain the curved shape. I attached a link in the description to a randomized clinical trial that looked at comparison of using cold versus regular temperature tube on successful nasogastric intubation for patients in Toxicology emergency department. The clinical trial concluded that it can be said that the cooling method of nasogastric catheters is an effective method to increase the success of nasogastric tubing in patients, which the results confirm the study hypothesis. But keep in mind that a cold NG tube is slightly firmer and may cause perforation with aggressive advancement. With that being said, some nurses may choose to soften an NG tube with warm water if the tube is too rigid. By placing the tube in a basin of warm water, it makes the tube more pliable, and it may be helpful for those with throat swelling from previous insertion. Thanks for watching this video. In the next video, we will talk about tips and tricks during insertion. As always, this video is for educational purposes only. See you next time.